Hi, coders. This is Miss Marie. I see Sarmi. Who else is here tonight? Can you tell me in the chat? How is everybody? Welcome to Friday Path and Lab Group Study. Now, I'm not seeing anything in the chat. There's Francine. Here's Jeannie. Who else? I see Deborah and Laura and Tina. Happy Friday. I feel like Romper Room Lady whenever I say that. I see Jeannie and Sarmi and Francine. Miss Josie's here with us tonight. Miss Josie, would you like to say hi to the coders?
Hi, coders. Happy Friday. Glad you're here.
Tina says I sound like the Romper Room Lady too.
I was laughing at that one. Hi, guys. How's everybody doing tonight? Hi, Jeannie. Hi, Charmy. Hi, Tina. It's good to be here. We're going to have a good evening with Path and Lab and Miss Melissa and Miss Marie. They put together a great presentation for you, and I'm excited to be here.
Speaking of Miss Melissa, the AMCI rock star, come on in, Miss Melissa, say hi.
Hi, guys. So glad to be here on a Friday. Hi, coders. Hi, Miss Jeannie, Miss Francine. Hi, Tina and Sarmi. I get to say hi as well. Well, Miss Marie, I think I will agree with Miss Josie. I think you've got great slides for tonight, and I think it'll be a great time.
Thanks. I think it'll be interesting. We have a whole bunch of stuff to go over tonight, coders. For instance, let me do the legal part first. All right. The CPT is copyright 2019 of the American Medical Association, and all rights are reserved. Fee schedules, relative value units, conversion factors, and/or related components are not assigned by the AMA, are not part of the CPT, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained herein. CPC is a registered trademark of the AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept, FTR, CHUN, AMCI Fab 7, and Flip and Tap are trademarks of AMCI. To start the time scenarios. And Miss Melissa, I believe this is yours. Would you mind reading this for me, please?
Not at all. All right, coders, here are your answers. A is cytopathology, B, immunology, C, chemistry, and D, other procedures. In what section of the pathology chapter of the CPT manual will a coder find codes for a FISH test, F-I-S-H test? And Miss Marie, a minute and a half, you think is enough?
I think so.
All right, starting now.
Thank you.
All right, I think that's been a little bit more than a minute and a half, but I think maybe we'll let you have a few more seconds.
They're doing quite well on this. All right, coders, I think most of you, looks like people are coming in with this. The answer, as most of you figured out, is A, cytopathology. It's pretty easy to find it. If you look up fish in the index, it says C, fluorescent in situ hybridization, which is, FISH is an acronym for that. So then you look at fluorescent, and look right here, it says cytopathology and gives you the code numbers. This is the kind of thing that you may actually very well be expected to research and find in your travels. So I suggest that you always remember, use your resources. If it's not in the subject category grouping at the beginning, I should have written that down because that's probably not the right name for it. If you go right to the beginning, page 517 in the 2019 book, it gives you lists of all the sections that are covered. And if you're not sure about something, make sure you look in the index. You can get great information that way. You got a couple answers particularly right on the CPC by using your index and your resources that way, didn't you, Miss Melissa?
I did.
Sometimes it will help you, even if you don't know what something is, it'll help drive you to the right answer because it'll show you the section of the manual that you need to reference. Just remember, you have resources. You just need to remember to use them, all right? Our next question, Miss Melissa.
Yes, ma'am. All right, coders, your answer A is 85730. B is 85520, C is 80299, and D is none of these. A patient with deep vein thrombosis requires heparin to maintain therapeutic anticoagulation levels. He has regular PTTs drawn to monitor his level of anticoagulation. What CPT code is reported? And I have 2.5 minutes ready for you to begin now. All right, coders, your time is up.
We have some fairly good answers here, but we have a couple differences of opinion. Okay, coders, the answer here is A, 85730. Let's walk through and see what's going on. The key words: deep vein thrombosis, heparin, therapeutic anticoagulation levels, PTTs drawn. And this is to monitor a level, all right? So 85730, that's thromboplastin time partial. It's abbreviated as PTT. It's right there in the code. So we know that PTT stands for partial thromboplastin time. If you don't have that chun with the PTT notation, I would do that, all right? Now, that exactly matches our keyword, regular PTT drawn, all right? Because we know it's blood. That's what drawn in. And so we're going to put a little smiley face by 85730 and look at these other guys. 85520 is a heparin assay. I know we have heparin in the scenario, but do we have assay in the scenario? Is that one of your keywords? No. They didn't say it. It didn't happen. Bye-bye. Keywords don't match. Bye-bye 85520. All right. 80299. Quantitation of therapeutic drug not elsewhere classified. Well, they're actually checking anticoagulation levels. The anticoagulation levels are due to a drug, but they're not looking for quantitation of a therapeutic drug the way that code language describes. So we are going to eliminate 80299. Since clearly 85730 codes for PTT, we can get rid of D, and we have just proven that 85730 is the correct answer. Does that make sense to everybody? Good. Make sure you adjust your chun so that you see that that's a PTT, all right? Good. Let me check something. Did you know inside the back cover, oh, it doesn't have PTT. Did you guys all know that there are common abbreviations inside the back cover of your CPT manual? Have you looked at that since you were a newbie? I see one coder said that they knew. Okay, if you go to the back cover of your CPT and you open up that fold, there's a whole list of common abbreviations. 2D is two-dimensional, 3D is three-dimensional. And this is on your CPT manual. Okay, it's a gold mine. Unfortunately, I thought of that because I thought, well, that's how you could know what PTT is. It's not written there, but you know what you could do? You could right now put PTT over there by that abbreviation list. And from now on, every time you find an abbreviation you didn't recognize, you're not going to be able to Google it in an exam. All right? So as you start to find these things out, just go ahead and add it to that list. You're allowed to make notes. Take advantage of it. Once you learn something or once you do some research, make a note so that you have that information forever, okay? It's helpful. You have lots of, I'm going to keep saying this, I'm going to drive it into the ground. You have lots of tools at your at your fingertips. You just need to remember to use them, okay? I've seen a couple people tonight say that they're worried about that they're able to answer everything right here, but they're worried about freezing during the test. You won't have to freeze if you remember where your tools are, coders. You're all clearly, we're slamming it like 90, 95%, almost 100%. And some of these questions, we are getting 100% answers. You guys know these things. Remind yourself, you talk to yourself more than you talk to anybody else in the whole world. So talk yourself up. Don't say, oh, I'm going to, oh, that's hard for me. Say, I'm really good at this. Think of how far I've come. Make positive self-talk. All right? All right, I'm going to get off my soapbox for a minute. Anyhow, the answer here is A. I'm glad that that was all useful to people, but don't forget your abbreviation list. Don't forget your tools. All right, our next scenario, Miss Josie, would you read it, please?
Yes, I will. A is C93.00, B is Z00.5, C Z52.3, C93.00, D is C93.00, Z52.3. A 17-year-old female has a bone marrow biopsy for examination as a potential volunteer stem cell donor for her mother who has acute monocytic leukemia, AML. What diagnosis codes are used for the typing of the stem cell specimens? 2.5 minutes, coders, you may begin. Hey, Miss Marie, we had a little bit of a split on this one.
I know, I'm looking at this. Okay, again, we're going to talk about two different plans of attack here, coders. Number one, just so you know, the answer is B, okay? Our keywords, 17-year-old female, bone marrow biopsy, examination, potential stem cell donor. Her mother has acute monocytic leukemia, or AML. Okay, we're talking about the typing of the stem cell specimens. All right, first thing, the patient, the person who's actually being treated here, does she have cancer? Right. So if she doesn't have cancer, doesn't that mean you can get rid of 3 out of these 4 answers? See? I noticed people were taking almost the full time. You didn't need to do that. Remember, when you look at the answers first, a lot of times you can cut your workload down. All right? So that's my unofficial, don't forget, look at your answers first and eliminate what you can. Once again, we're coding for the donor's examination, all right? They get stem cells from bone marrow. So that's what we're looking for. Again, C93.00, that's the code for the AML that her mother has. That's got nothing to do with the patient that we're coding for right now. So we're absolutely getting rid of A. I think we should get rid of C and D too. But we're going to look and see what these two Z codes are, okay? First, Z00.5, encounter for examination of potential donor of organ and tissue. Pretty much matches all of our essential keywords, doesn't it, coders? Yeah, pretty much does. And it's the only code there that doesn't have a cancer code on it. All right, so we like that a lot. It matches our keywords and it gets a happy face. So let's look at Z52.3 just to be thorough. That says bone marrow donor. Is she a donor yet, or is she just a potential donor to see if like her bone marrow will even work? She's a potential donor, all right? So that's not an accurate code. So we get rid of C. B is our answer. Does anybody have any questions, or does this make sense to everybody? Let me know in the chat. Got it? Okay, good. Remember, think about that. Think about looking at your answers and identifying what just cannot be right. That's how you pick up time on the CPC exam. You don't waste time looking at stuff that can't be coded. All right? Answer again is B. Okay, next question.
Oh, excuse me, you caught me mid-yawn. All right, coders, here are your answers. A is 86927, B is 86927 times 4, C was 86931, and D is 86931 times 4. What is or are the codes for thawing 4 units of fresh frozen plasma?
I think we have unanimous answers on this one. Good job, coders. Okay, this one. The answer is B, 86927 times 4. Keywords, thawing, 4 units, fresh frozen plasma. All right? Looking at this, 86927, thawing. That's an important thing. And this, in fact, 86927 is fresh frozen plasma thawing each unit. When you see the word each in your CPT manual, coders, what does that mean? Right, it means you have to give a quantity for each unit. Therefore, since we know they're doing 4 units, you could, once you looked at that descriptor, you could immediately eliminate A, couldn't you? Because you know you're looking for a 4. Right? All right, let's check out these other codes. What else is going on here? I like B a lot, but let's look at 86931. 86930, the parent code is frozen blood each unit. Blood is different. It's a different substance than plasma. And even though 86931 is thawing, it's talking about thawing blood, not thawing plasma. So we're going to eliminate C and D. And we confirmed 86927 times 4 is our correct solution. Make sure that your chun shows you every time you see the word each. I was so paranoid about messing up on the quantities when I was getting ready to test. I not only I underlined the each, and I put a little dot next to the code so that I had 2 ways to remember that I needed a quantity on that code. You don't have to do that. I'm just telling you what I did because I was worried. Okay? Answer is B. I'm going to guess none of you have any questions because everybody got that right. Ready to keep going? All right. Let's hit the next one then. Miss Josie, would you mind reading this, please?
Yes. A is 86805, modifier 26, 86817. B is 86817, 86821. C, 86816, modifier 26, 86821. D, 86806, modifier 26, 86817. A patient will be undergoing a transplant and needs with DR, DQ, multiple antigen, and lymphocyte mixed culture. How will these services be coded? Okay, coders, 2.5 minutes, you may begin. Hey, coders. Time's up. You go ahead and change your answers if you need to change your answer. You guys did real good.
Okay, guys. Once again, 2 methods of going about this. What do you notice in these solutions? Yup. Do we need modifier 26? And the other thing is, if we had modifier 26 on one of the lab codes, wouldn't we need it on both of the lab codes? So how many of you went straight to look up the codes on B and ignored the other mumbo jumbo? Good, 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 good. That's what we want to hear. You know, anytime you can cut your workload down, do it. Be aware of the hints that you're getting, okay? All right, our answer is B. Most of you got that. Our keywords, transplant, HLA tissue typing, DRDQ multiple antigen, lymphocyte mixed culture. Okay, and all it asks is how will these services be coded? It didn't say anything about professional services. It didn't say about, you know, the pathologist, none of that. We don't need modifier 26. So we could cut to the chase and just verify the codes in B. We're going to be thorough though. So HLA tissue typing, DRDQ multiple antigen, lymphocyte mixed culture. Those are the most important of these keywords. So let's look. Lymphocytoxicity assay, virtual cross-match. I don't see any of that in this scenario. If I wasn't already sure that it was a bad answer, I am now doubly sure because the keywords do not match. All right. 86806, that's lymphocytotoxicity assay, virtual cross-match without titration. I still don't care because it doesn't match my keyword, so I'm getting rid of it too. All right. You don't even have to know what all these word salad stuff is. You just need to be able to match your keywords to the code descriptors. That's why I keep harping on being very precise with your keyword selection, coders. Look at 86812 as HLA typing. So we're in the right family now because that's what we're looking for. But what kind of HLA typing are we looking for? We're looking for DRDQ multiple antigen, so we like 86817. That matches our keywords. And we like 86821 because we're looking for a lymphocyte mixed culture. So B gets a couple of those little smiley faces. And then we're going to just peek at 86816. That's DRDQ, which is in our thing, in our keywords, but 86816 is only for a single antigen. That doesn't match. So we're kicking it to the curb. All right. B is our answer. I think everybody got that. And let me know if you have any questions or if you've got it and we should move on. Okay, good. Good, good, good. Let's keep rolling.
Okay, here are your answers, coders. A is 82947 and 82947 with modifier 91. B is 82947 and 82947 with modifier 76. C is 82948 and 82948 with modifier 91. And D is 82948 and 82948 with modifier 76. A 35-year-old type 2 diabetic is feeling weak. The physician performs a stat glucose test in which a finger stick is done, placing the drop of blood on a reagent strip. The test indicates the patient is hypoglycemic. The physician gives the patient some glucose supplements and performs another stat glucose test using the same lab test as before 30 minutes later. The second test shows the glucose levels return to normal. How are the lab tests reported? And I have 2.5 minutes ready for you to begin now. Okay, that is time.
Thanks, Miss Melissa. Okay. We have a little bit of a difference of opinion here. So let's start walking through this. Coders, just so you know, the answer here is C, 82948, 82948 with a 91 modifier. Our keywords, 35-year-old, type 2 diabetic, stat glucose test, finger stick, drop of blood, reagent strip or regent strip. Hypoglycemic, glucose supplements, another stat glucose test, same lab test 30 minutes later. All right, let's look at this. 82947, 82948. 82, we're talking about a stat glucose test, and he used a reagent strip. All right. 82947 says glucose quantitative blood except reagent strip. That means we can't code. We can't use 82947 because for this particular scenario, because they've made it very clear how they did this. So we eliminate A and B. All right. 82948 is a glucose test blood by reagent strip. All right. Now, we know that he did this twice. So the difference between C and D is which modifier we want to use. right? We need to know which modifier is appropriate. Now, 76 is a repeat procedure or service by the same physician. I don't really like that because don't we have a more specific modifier code that we use for laboratory work? Why, as a matter of fact, we do. It's 91. Repeat clinical diagnostic laboratory test. That is what we use in this section of the CPT. That's used when the same laboratory test is done more than once on the same day in order to obtain subsequent or multiple test results, okay? This means that C is our answer. I see that some people were picking A. Nobody chose the wrong modifier. I'm hopeful that all of you eliminated B and D off the bat because you knew that wasn't the appropriate modifier. So I want you to make sure that you check your chun on this code so that it's very clear that that word accept pops right out at you. All right. Okay, looks like we have time for another one. Let's keep going, coders. Unless somebody's got a question, I'm going to move on. All right. Miss Melissa, if you would, please.
Oh, I am so sorry. Sure. A is 80050. B is 80050 with modifier 52. C is 85025, 84443, 82040, 82247, 82310, 82374, 82435, 82947, 84075, 84132, 84155, 84295, 84460, 84450, and finally 84520. And D is 80050 with modifier 22. A physician orders a general health panel, all tests except a creatinine, including CBC with automated differential. What CPT code or codes is or are reported? And I've got your time set for 2.5 minutes, and you may begin now. Oh my, that time seemed to go by fast on this one. Your time is up.
It sure did go quickly. I'm seeing a little bit of variety of answers here. So let's move through this. First coders, please turn to page 537 in your 2019 book. Look at the guidelines for organ or disease-oriented panels. These panels were developed for coding purposes only and should not be interpreted as clinical parameters. The tests listed with each panel identify the defined components of that panel. If you chose either answer B like boy or D like David, I'm going to tell you right now, you need to go back and review the pathology videos because you cannot increase or decrease the components of a panel. You have to have every single last one of them. So the clue here that you should remember, once you looked at the general health panel and you saw that it included creatinine, you should have known that you're going to have to code everything separately. And if that didn't pop right out at you, I want you to go back and review that video, please. Okay, let's go stepping through this. All right. Answer is C. Our keywords, general health panel, all tests except a creatinine, including CBC with automated differential. All right. So a general health panel, 80050. This panel must include the following: a comprehensive metabolic panel, which is 80053, blood count, complete CBC, automated differential WBC count, which is 85025 or 85027 and 85004, or blood count complete, which we call a CBC, automated, which is 85027, and appropriate manual differential WBC count, 85007 or 85009. And this general health panel also includes a thyroid stimulating hormone or TSH test, which is coded singularly as 84443. All right. Now, a comprehensive metabolic panel, 80053. Look at this. This tells you the components. We know that that he said he does not want a creatinine, and that is part of this panel. That means we cannot code the panel code. Is everybody clear on that? If you do every test included in the panel, you cannot code the panel. Just knowing that, as soon as you saw the accept and looked over to see that that test was included in that panel, you could have then known that you were going straight for the long answer. All right. Let's go through this one by one. Again, panel codes can only be reported if all of the tests in the panel are done. If any singular test is left out, and in this case creatinine was not included, we have to code each test individually. All right. So we're getting rid of A and B. And again, we're going to code each of these tests. Luckily, look at that. They gave us all the numbers that we need. So we're going to pull a CBC with automated differential, which right here, it tells us is 85025. We need to include the thyroid stimulating hormone, TSH. It tells us it's 84443. Okay. Then we just go down this list. Albumin, 82040. Boom. Bilirubin total, 82247. Boom. Calcium total, 82310. See, we just keep going down this list and we can verify every single one of them. We don't even have to flip any pages. It's easy. It's a little time consuming to make sure that you don't, get a number salad going, but really, all the information's right there. Okay? Just like we can't code less that's included in a panel, we also cannot code and use modifier 22 to increase what's included in a panel. A panel is a panel is a panel. All right, so the answer is C. Does that make sense to everybody? Do you have any questions? Got it? All right, good. All right, we have 7 minutes left. I thought I hid this. Just a second. I'm going to go. I want to skip this one because I want to get to another one. This is a similar exam. I promise you I will bring you through next time. This is the one I want you to solve tonight. Miss Josie, would you please read this for me?
Yes. Okay. A is 80502. B is 99244. C 99244, modifier 25, 80502. D is 99255, modifier 25, 80500. Dr. Monday provided a comprehensive clinical pathology consultation at the request of Dr. Adams. This request was regarding a patient with various infections, drug allergies, skin rash, and Down syndrome. The patient is in the hospital intensive care unit being treated with intravenous antibiotics. Dr. Monday did not see the patient, but he reviewed the patient's history, complex medical records, and provided a written report back to Dr. Adams regarding his findings and recommendations for further treatment. How would Dr. Monday report his services? Okay, coders, we'll do the 2.5 minutes, and if you need more time, we'll go from there. You may begin. I'm going to give you a few more seconds, coders, to get your answers in. Okay, coders. I think it took a few more seconds, but it looks good here. I think everybody is getting their answers in, and so far, so good.
We're in pretty good shape. I'll give you 10 more seconds. I think we still have a few people working on it, but I know we're getting close to 10 o'clock and I don't want to keep you too long. That's a very good point, Patricia. We're going to talk about that in just a minute. Okay, coders, right now, I'll let you know the answer here is A. Our keywords, word coding for Dr. Monday, comprehensive clinical pathology consultation, did not see the patient, but reviewed the patient's history, complex medical records, provided a written report back to Dr. Adams. How would Dr. Monday report his services? Okay, coders, we're going to look at this. For an office consult, did he go to the office? Doesn't it tell us that the patient was in the intensive care unit? Right, so we can get rid of 99244. See that little, do we all know what that little star means next to the code? The star means that it's available for coding by telemedicine, meaning over a video call or something, but we don't have that either. In fact, our scenario tells us Dr. Monday did not see the patient. This is clearly 99244. That's some sort of face-to-face or face-to-video. That didn't happen, so we can eliminate B and C. We're going to take a look at 99255, and that's an inpatient consult. The same deal, though. That's supposed to be a face-to-face or a face-to-video. Did not happen. We can get rid of all three of those little rascals, B, C, and D, right off the bat because Dr. Monday did not see the patient. That's why keywords are essential, okay? The minute you saw did not see, you could have eliminated three of these four answers, and then all you had to do is go to 80502 and make sure that it conformed to the information we were given. All right? It's a comprehensive clinical pathology consultation. So 80500 is a clinical pathology consultation. 80500 is limited without review of the patient's history and medical records. We know that we had a comprehensive. We know that he had a request from Dr. Adams. We know that he reviewed the patient's history, the complex medical records, and provided a written report back. And look at the description on 80502. Clinical pathology consult, comprehensive for a complex diagnostic problem with review of patient's history and medical records. All of our keywords, all of our key phrases match, don't they, coders? Yeah. We're going to double check our parenthetical notes because that's what we need to do. That we don't have any information about pharmacokinetic consultation, so we don't care about that note at this moment. And see what it says for consultations involving the examination and evaluation of the patient, see 99241 to 99255. Again, we don't care because Dr. Monday did not see the patient. So we have confirmed that A is our answer. Does that make sense to everybody, coders? Does anybody have any questions on that one? All right. All right, good. I have to tell you, coders, that I think you all did a fabulous job tonight. Everybody was on point. You guys were solving things quickly. You were very accurate, and you should be very proud of yourself because I think that you did an outstanding job. All right? Here it is. I'm giving you all some applause. I think you should congratulate yourself. You should pat yourselves on the back. You did an absolutely fabulous job tonight. Miss Melissa and Miss Josie, you guys were stellar as always. Do you want to come in and say goodnight to the coders? Did anybody learn anything new or have an aha moment tonight? If you did, that is outstanding. Do we have anybody that's sitting for the CPC exam tomorrow morning? I don't think so. I think we have someone in a week or two.
Well, we have a couple said they're going to boot camp this weekend, so that's great.
That's fabulous. You guys are going to love boot camp. Go get rest. Those of you who are going to boot camp, go get rested up. I hope you have a great weekend, everybody. Again, please give us some feedback. Let us know. And in the short answer that is allowed you, if there's some part of Path and Lab that you want to make sure that I give you some scenarios on next time, would you please tell me that? If you know right off the top of the head and you want to put it in this chat, that's fine. One way or the other, I'd really like to know what you need clarification on. Okay? Again, Miss Josie, Miss Melissa, thank you very much. You guys are fabulous. Fabulous, fabulous.
Thank you for
Thank
having
you.
us.
Yes, thank you, coders. I enjoyed my stay with you guys. You guys are getting faster in the chat. You guys are certainly understanding what you're doing in the pathology and lab section. And I learned something new tonight. I actually enjoyed going over the big scenario where we had to code the exception with the one panel, and that's always good refreshment. So thank you.
I'm glad everybody had a good class. I hope you have a fabulous weekend. We're running a little overtime, and I do apologize for that. But I did want you to see that scenario. All right? Thanks, everybody. I hope you have a great weekend. Thanks again, Miss Melissa. Thanks again, Miss Josie. I'm going to shut this webinar down, coders, okay?
Good night.
Good night.